Hi, this is Dr. Saravanan. I'm a laparoscopic surgeon. Today we'll be talking about the precautions and challenges in multiple surgeries in a single day. So, we have done multiple surgeries in a single day, like laparoscopic surgeries. So, maximum the number of surgeries we have done in a single day is like 5 to 6 surgeries, and more than that, I tell my fellow colleagues also not to do more than 6 surgeries, because after 5 to 6 surgeries, what happens, the mind becomes tired and the decision making becomes challenging. So we have done 5 to 6 surgeries in a single day. The precautions what we have to take is the instruments. The instruments should be sterilized, and time should be given for the sterilization of these instruments. It's not just once you finish the surgery, if you have another instruments which has already been sterilized, then it's good. But if you're going to use the same instrument, you have to give time for the sterilization of these instruments, and then you use the instrument for doing the surgeries. Main thing is instruments plays a main role in sterilization all this, because once if infection happens, even though you do a very good surgery, the port infection or anything like that happen, that will create a bad name for the surgeon. So he has to be very aware that his instruments and everything is being sterilized, and the OT room is being sterilized, and all that he has to see. Even though surgeon don't have time for all that, but he has to have a look at all these things, because it plays a very important role after the surgery, because any infection, port infection are the very deadly one. It's really sad that the major part of the surgery is okay, and the port infection causes so much problem for the patient. And once you get these kind of port infection, it keeps on going. It doesn't get cured immediately, and it keeps on nagging. So it's better you do it in a very sterilized environment and sterilized equipment. That's very good. And one more thing, I make sure that I don't put a difficult case in when I'm doing a multiple surgeries, because if you put a difficult case, you need your concentration and everything. So your mind should be stress free. So if it's an easy case, it's okay. But if it's a very complicated case, I normally don't put on when I'm doing multiple surgeries. I put on some other day where you have a lot of time and concentrate, and you do that. After laparoscopic surgeries, it's easy to do multiple surgeries, because the closure is easy and doesn't take time, and laparoscopic surgery we can do it very fast. So laparoscopic surgery is giving rise to doing of a lot of multiple surgeries in a single day. And another thing is, before doing all the surgeries, make sure that patient has all the fitness done by the anesthetist, so that the blood sugars and the cardiac clearance and everything is done, and then you can do a stress-free surgeries, which is very important, because if a patient is not having a proper cardiac clearance, and anesthesia risk is very high. So even though the surgeon does a good surgery, if something happens in anesthesia or cardiac arrest happens, then the surgeon has to take the whole blame. So make sure that all your patients are being cleared and of all this stuff, and get it done. The patient has to do all the pre-op tests, such as blood sugar, INR and ECG, chest X-ray, viral markers, thyroid. These tests are all done, and it's been checked. If they are all in the normal limit, then the patient is being fit for surgery. Then after that, the patient goes to the anesthetist, and he does another round of checkup. Then after that, if the patient is fit for the surgery, then that's how we post. Because I've seen a lot of patients, they come and they say, "Sir, finish my surgery tomorrow itself, and we would like to go day after tomorrow." Then what happens when they go to when they may have some cardiac issues and all that? We have to rectify all that. Then only we can do surgeries. So patients also have to understand it's for their good only that we do all this pre-checkup before the surgery, so that they'll have a safe surgery and a good surgery. So yeah, it happened. Like some of my patients, like they have come with a high blood sugar level and all that. So we give a referral to the endocrinologist, and they control the sugar, and they make them in sliding scale, and when then after that the anesthetist give the fitness. So there are certain cases when blood sugar is very high, but we have to do like as for example a huge abscess, and the blood sugar is high, so you have to remove the abscess, then only he's going to get healed. So we start them in a sliding scale with insulin and all that, and then after that we do the surgery. The next day patient recovers very well. So these are certain challenges you get through. There was this patient I had, he was in clopidogrel, he was taking this cardiac medicine, blood thinners. So but the patient wants a surgery. It's an emergency procedure. We have to give him FFP and all that. During those things, if it's an emergency surgery, it's a do or die situation. We have to do it. There's no other go, because if you don't do the surgery, the patient will get into problem. So if that is the thing. But if a patient in blood thinner, the problem is it bleeds inside. But patient also comes in emergency time, so we are like in a fix. So certain times you have to take the decision and do the surgery. When we do some laparoscopic cases, sometimes what happens, the heart rate goes down and fluctuates, and then we have to like bradycardia we get, and then we have to release all the gas out, and wait for the pulse to the heart rate to go up and the BP to go up, then we start to, there are many challenges. The main thing, you have to be calm, calm, and they say the surgeon should have an eagle eyes and a lion's heart, so you have to control the bleeding, and slowly you proceed and you go. It comes with the experience. The OT is a team. You have the anesthetist, you have the scrub nurse, you have the assistant, you have the surgeon, and it's a teamwork actually. So everyone plays a role over there. The anesthetist plays a role so that the patient, he monitors the BP and saturation and everything. Surgeon takes good care when he's doing the surgery, seeing that how operating skills and all that. And an assistant is very important, who holds the camera. In laparoscopic surgery, the person who shows the camera plays a very important role. If they show the camera properly, only a surgeon can operate. So the showing camera is also a skill. So I will say it's a big teamwork. It's not a one-man show over here. So that's how. If the team is strong, the surgeries can be done very nicely. Modern day OT room, laminar flow, you have sterilized equipments and good lighting and good equipments, instruments. All these are the modern day